Unraveling the connection. The role of inflammation in chronic diseases. 1. Introduction. The double-edged sword of inflammation. A fundamental response. Inflammation, typically a protective response to injuries and infections, is a complex biological process. However, when this finely tuned mechanism goes awry, transitioning from acute to chronic, it can become a driving force behind various chronic diseases. 2. The basics of inflammation. A body's defense mechanism. Guardians of health. Acute inflammation is the body's immediate and early response to injury or infection. White blood cells rush to the affected area to neutralize harmful agents, remove damaged cells, and initiate tissue repair. Inflammatory mediators. Signaling molecules like cytokines, chemokines, and prostaglandins orchestrate the inflammatory response, ensuring a swift and targeted reaction to threats. 3. Chronic inflammation unveiled. A prolonged battle. Persistent culprit. Chronic inflammation, in contrast, is characterized by a prolonged and dysregulated immune response. This persistent state can result from unresolved acute inflammation, autoimmune disorders, or exposure to environmental factors. Inflammatory cells on overdrive. Chronic inflammation involves the sustained presence of immune cells, leading to the continuous release of pro-inflammatory mediators. This persistent activation can damage healthy tissues over time. 4. Linking inflammation to chronic diseases. A multifaceted relationship. Cardiovascular diseases. Chronic inflammation plays a pivotal role in the development and progression of cardiovascular diseases. Inflammatory processes contribute to the formation of atherosclerotic plaques, increasing the risk of heart attacks and strokes. Metabolic disorders. Conditions like obesity and type 2 diabetes are closely associated with chronic low-grade inflammation. Adipose tissue inflammation and insulin resistance create a feedback loop that exacerbates these metabolic disorders. 5. Inflammation and neurological disorders. The mind-body connection. Neurodegenerative diseases. Chronic inflammation has been implicated in the pathogenesis of neurodegenerative disorders like Alzheimer's and Parkinson's disease. Inflammatory processes may contribute to the progression of these conditions. Mood disorders. Emerging research suggests a connection between chronic inflammation and mental health disorders, including depression and anxiety. Inflammatory markers may influence neurotransmitter function and neural circuits related to mood regulation. 6. Inflammatory bowel diseases. The gut as a battlefield. Crohn's disease and ulcerative colitis. Inflammatory bowel diseases, IBD, involve chronic inflammation of the gastrointestinal tract. The immune system's misdirected attacks on the gut lining result in symptoms such as abdominal pain and diarrhea. 7. Rheumatoid arthritis, where self-defense goes awry. Autoimmune component. Rheumatoid arthritis is an autoimmune disorder characterized by chronic inflammation of the joints. The immune system mistakenly attacks healthy joint tissues, leading to pain, stiffness, and joint damage. 8. Cancer and inflammation. A complex relationship. Tumorigenesis and inflammation. Chronic inflammation is associated with an increased risk of cancer development. Inflammatory processes can create a microenvironment that promotes DNA damage, cell proliferation, and angiogenesis, factors conducive to tumor growth. Cancer treatment implications. Inflammation also influences responses to cancer treatment, affecting the efficacy of therapies such as chemotherapy and immunotherapy. 9. Lifestyle factors and chronic inflammation. A call to action. Diet and nutrition. Certain dietary patterns, such as those rich in processed foods and saturated fats, can contribute to chronic inflammation. Conversely, diets high in anti-inflammatory foods, such as fruits, vegetables, and omega-3 fatty acids, may help mitigate inflammation. Physical activity. Regular exercise has anti-inflammatory effects on the body. Physical activity can modulate the immune response, reducing chronic inflammation and promoting overall health. 10. Conclusion. Navigating the inflammatory landscape. Balancing act. While inflammation is a natural and essential component of the body's defense system, chronic inflammation poses significant health risks. Understanding the intricate interplay between inflammation and chronic diseases opens avenues for preventive strategies and innovative treatments. Holistic approaches. The recognition of lifestyle factors, environmental influences, and genetic predispositions in chronic inflammation underscores the need for holistic approaches to healthcare. By addressing inflammation at its roots, we can pave the way for a healthier future, mitigating the impact of chronic diseases on individuals and societies alike.